Hi and welcome to another video from the CTAD Clinic. My name's Dr. Mike Lloyd and I'm the Clinic Director. And today we're going to discuss something that crops up from time to time in therapy that can be really aggravating and frustrating for people. And that's the nature of when alters or parts seem stuck in time. We know that many alters don't really always develop or progress in terms of their age, but some seem to be stuck in a time that isn't in the present. So people might talk of having parts who don't know about the reality of the present day. So this is especially important for people of an older age where the trauma that may have been experienced is a long time ago and the parts are somehow stuck in that time. It might be as if they're acting or behaving or feeling as if the trauma is still present, that they are literally stuck in that time. Could be 10 years, could be 20 years, could be 30 years ago, even longer. Or it may be that they just don't really have an awareness of the present day. So everything seems surprising and shocking. And when they come out, they don't know where they live. They don't know the people that are around them. They may not recognize anything about what's going on. And they might be having like a complete derealization experience where they don't recognize the people, the places, the settings, the scenarios, because it's as if they've just somehow relocated themselves from the past into the present, and that's very confusing for them. It can be very disorientating for everybody concerned, and it can be very distressing. It isn't necessarily something that can be solved easily, and again, as with any of these things, it's recommended that such processes get worked out in therapy and where they can be talked about, where the part can maybe be helped to understand what's going on, but it's always best done with support people involved. Obviously, that's not possible for everybody, so take care. If you are thinking about sort of doing some work on this, please be aware that it might not be an easy thing to do. The main goal of it is realistically to try and help that part understand about the time in the now, the present day. So we have to understand what the reasons might be, why it isn't happening, why they are stuck in trauma time or stuck in the past. What it can mean is there's a lack of trust or confidence in the present day, either with the person who's kind of running the show in the real world, or that the present day just seems to be out of kilter with their understanding of things, or they don't like it, or it's scary, or it's frightening, somehow disorientating in that respect. They might not want to be in the present day is a question that we have to sort of take account of, that being in the past might feel safer than being in the present, and that has to be understood. There may be also a wish to pull the present into the past, that there is something in the past that needs to be witnessed, heard or understood. And actually, in order for that to happen, the present has to relocate itself into the past, i.e. to go into trauma work. And that might be that there's been a lot of denial, or there could be that there's amnesia present and that's not possible. And that might not be a safe thing to do, but it doesn't mean that it doesn't need to be done at some point. Again, it's about understanding and having empathy towards that part for being stuck there. And if they do wish to pull everything back into that time and have that trauma brought out and understood and witnessed, and until so they are going to remain stuck, it has to be a wise decision and a careful decision in order to go back and do that work. And again, therapy is the construct that would be most recommended to undertake that in. In the meantime, it's about being patient. What can be done is helping the part understand that the present is safe. So being able to say to that part who's stuck in time, who seems really disorientated in the present day, to say, look, I know you're disorientated. I know it feels really strange, but actually this present is fine. We have grown into this present day. This is of our choosing, assuming it is safe and it is good, obviously, that this is of our choosing. This is where we feel comfortable. This is where we need to be at this moment in time. And you're welcome to join us. If you choose not to, that's fine, and we will be understanding, we'll be patient. The way that you see things is different from the way that we and others might see things. Not to try and change it too much, not to get angry or not to get frustrated with that part because they don't follow that narrative, is to be respectful of the narrative that they've got and know that there will be a reason for it. All comes back to that internal logic. If a part is stuck way back in the past, in a different year, in a different building, in a different town, city, country, whatever it might be, there will be a reason for that. If you don't know that reason at the moment, chances are it's because you don't need to know, and all that you need to do is be patient, compassionate and understanding, and allow time to be able to gather itself and figure it out for you. Therapy can help, time can help. but maybe just making that part feel welcome anyway, and helping them understand that the present is different, but making them feel safe and comfortable and welcome in the present. It's very easy to just want to dismiss that part and go, you know what, you're doing my head in, you're really frustrating, you're so annoying, you keep messing about, you don't get it right, I don't want you. That's not the way to go. As with all of this stuff, it's about compassion and understanding and patience. And if we bring all of those things together and allow time or the right circumstances to sort of guide when this change in present to past or change in past to present can take place, then we have to hope and be guided by the principle that the brain knows what it's doing, and that will take place at some point as and when it's ready. So I hope that's been useful. It's not an experience that everyone has, but if a person does have an experience of an alter that's like this, it can be quite difficult. And hopefully that some of the things we've talked about today at least sort of ease some of that tension and make it less of a battleground and make it more of a sort of a welcoming scenario. That's the hope with any of these kind of techniques and processes. It's to just change the perspective on it and make it less of a problem and more of something waiting to be solved. So hopefully that will help. Please do continue checking out the content on the channel, like and subscribe as always, and leave comments below. I do read them and they are really important to us. So thank you ever so much, and in between now and the next video, please do take great care.